Dr. Ronnie Whitfield has joined us, or is in the process of joining us now.
Dr. Bryant, hello there.
Hello, can you hear me?
Yes.
Yes, we can. Thank you so much for joining.
Oh, you're welcome. I'm glad to be here. Thank you.
Brother St. John, you said someone else would join?
Yes, Mr. Calvin Mackey has joined us.
Dr. Mackey, good evening, sir.
Good evening to you, sir. How you doing?
I'm very well. Thank you for being here, and serious shout out to the Forbes article with the on STEM and coronavirus. That was skillfully written, my brother.
Thank you. Thank you. Hopefully more will be coming.
Oh, you've been in the lab for a few days now.
There it is. Hello to everybody else.
Good evening.
Hey, how you doing?
Good afternoon.
St. John, is Mike Crawford in the waiting room?
Correct. Just a moment. We're letting Mr. Mike Crawford in now.
Greetings, Brother Crawford. Welcome.
My volume, I need a little bit more. St. John.
Yes.
Mr. LaCour.
I see him.
Okay.
Thank you.
You're welcome.
Jeffrey, welcome.
Pastor Jetson, are we on? Can y'all hear me?
Yes, sir. We can hear you, doctor, and that's $1 you owe me.
You're gonna learn, Doc. Off them coins, you're gonna learn.
Leave him be, man. I need to buy some more golf balls for when I can go outside and play.
Fair enough.
Doctor, can you hear us?
Mic check, mic check. Can you hear me, Pastor Jetson?
Yes, sir. Can hear you well. Can you hear us?
Donnie Rose, can you hear me?
Yep, hear you
I
good.
can't hear you guys.
Can you hear now?
Say something, Donnie?
Hip Hop Doc.
There we go. There we go. All right.
Cool.
I'm in the building. Hello, everyone.
Hello.
Welcome. So just to catch you up, you owe me $2 for those 2 Pastor Jetsons.
That's right. That's right. Brother Jetson, would that work?
That'll work, but
All right.
box of golf balls kind of expensive, so you can get.
It's tight right now. You're gonna have to let me off the hook.
St. John, how many of your facilitators do you have logged in?
We have Jeffrey, Anthony, Mr. Bernard, Mr. Kirby, Mr. Don Kelly, Mr. Mike Crawford, Mr. Eugene Bentley, and Mr. Jamal Smiles. That's 1, 2, 3, 4. Excuse me. 1, 2, 3, 4, 5, 6, 7, 8. We are missing Jeff Williams, Larry Miner, and James Riley to be accounted for.
Check the waiting room.
Will do. Mr. Larry Miner is here. No, admit him now.
Mr. Riley is waiting also.
Thank you.
Brother Minor, Pastor Riley, thank you so much for being here.
Good evening. Good evening.
So to all of the panelists, we're going to actually open up the waiting room and let people in at 5:59.
Okay.
At about 6:01, not later than 6:01:30, I am going to get started. And so we will be going, and I have about a 2.5, 3-minute opening, and then we will be into the questions. And just as I've shared with you guys in our conversations and emails, if I stop asking questions because y'all are having a conversation with one another, it will be a good webinar. And so please, don't wait on a question or prompt. As you guys hear one another and the points, I'm going to ask Dr. Mackey the first question and follow up with Dr. Bryant. And as you guys know, I have questions for each one of you. But if they put something out there that you feel like you can dive on, please, let's just have a good conversation.
Pastor Justin, are you going to do the breakouts, or are we just going to flow through the conversation?
So we're going to do the conversation, and that's $3.
Nah. I'm doing bad. I'm just going to give you my credit card.
We're going to do the about 25 minutes with you guys, and then people are going to be automatically taken to breakout groups. The names you heard me greeting are facilitators for those small groups, and they will go into small groups for about 20, 25 minutes, and then we'll come back and do a closing. I don't want to lose all of my brothers with the NFL draft.
Yeah, that's right.
We're allowing people.
Jetson,
Yes, sir.
Brother Jetson, are you going to make available the report to everybody? Because I know probably somebody going to ask where can we find this report?
The 2010 report?
Yes.
Yes, sir. We will share that with the, when we send out our thank you, we'll just include the 2010 report.
If you can post it to your website somewhere, that'd be great too, because I can potentially drive people to your website.
We will do that. Sharita and Tarina, please make note of the 2010 report.
Yes, sir.
Yes, sir.
We're now admitting all.
I thought I saw Dr. Bryan. Is she not on the screen with us?
He's here.
Everybody's here, Doc.
Mackie, what's up, brother?
How you doing, Doc?
Tired.
It's been a minute, man.
Well, last time I saw you was at the gig we were playing.
Oh, I
In
know.
New Orleans. In New Orleans.
I yearn for those days again.
I do too. I miss playing. We're gonna do something virtual. The band is itching to play.
Well, let me know.
I will.
Hi, guys.
Hello.
I just unmuted myself.
Who is that? Dr.
Hi,
Brown?
guys. Trudy White. I just unmuted myself.
Oh, okay.
And so good evening, everyone, and welcome to Racialized Rationales, an open exchange on dehumanization and the disparate impact of COVID-19 on communities of color. My name is Raymond Jetson, and I will be your moderator for tonight's encounter. On behalf of the Metromorphosis team, the delegates of the Urban Congress on African American Males, and this distinguished panel, thank you for joining us. Allow me to begin by sharing with you an overview of our time together. We will spend about 25 minutes mining nuggets of wisdom from this wonderful panel we have assembled. After this, you will be automatically moved to smaller breakout groups where a facilitated discussion will happen as we seek to hear and gather the wisdom of the collective. We will then reassemble for just a few moments to say thanks and share next steps. You see, our experience is not just about tonight and what we say. It is about what we are willing to do about what we say tonight. You are invited to share the experience on social media. The hashtag is moment or movement. And so let's make the most of our time and meet our panel. Dr. Rhonda Bryant is the co-director of Forward Promise, an initiative focused on the health of boys and young men of color. She's a policy advocate and a mother. Judge Gail Grover currently serves as judge for the Juvenile Court Division B of East Baton Rouge Parish, a system reformer and a wife. Donnie Rose is a poet, teaching artist, community activist, and a Black man. Dr. Calvin Mackey is an inventor, author, speaker, entrepreneur, and father. And Dr. Ronnie Whitfield is an impassioned advocate for increasing the awareness of health-related issues, a community activist, a musician, and a husband. To these panel members, I say welcome, and let's dive in. We are here tonight because the old saying is true. When America catches a cold, Black people catch pneumonia. COVID-19 has preyed upon generational inequity to heap tragedy and loss on people of color. And so we see news stories of families being turned upside down. A father and a stepson gone from a family because of COVID-19. We see statistics that highlight the truth that we already knew. That decades and generation of inequity left people of color exposed in great ways to this virus. Dr. Mackey, I'd like to begin with you. 10 years ago, you were the chair of the Commission on the Success of Black Boys and Men, the original one. How does the report that commission released in 2010 relate to what we see happening with people of color because of COVID-19?
Brother Justin, thank you for having me, and thank you for bringing this, this forum together and giving people an opportunity, one, to voice their opinion, but also hear other people's opinions about how we move forward. In 2010, you and I both had the opportunity to be members of the Louisiana Commission on the Social Status of Black Boys and Black Men. And that commission was established in 2008 when House Bill 876 was passed in the Louisiana legislature. The bill was authored by now Congressman Cedric Grisham to create the commission. And the whole goal was the commission was to do a data-driven research project to understand where Black boys and men were, and more importantly, where the trajectories were heading, and what we needed to do as a state to change the trajectory for the status of for Black boys and Black men. And the sum total of our findings showed that the Black males at every age, across every station in life, were in imminent crisis, had been in crisis, and we concluded that they will continue to be in crisis until fundamental systemic changes were enacted by collective stakeholders. Tragically and poignantly, the following not only demonstrated but validated the socio-demographic and the socioeconomic quality of life indicators for Black males in the state of Louisiana. Those indicators showed that the quality of life for Black males were not only the lowest in Louisiana, but actually the lowest in the nation. We did a Human Development Index analysis. The HDI is something that the World Health Organization used to look at the state of countries. And they compared this HDI of countries to give you a quality of life from country to country. We did an extensive research, and what we found that the HDI for Black males, well, the HDI for white people in the state of Louisiana was 10 years behind the rest of the nation, but we found the Human Development Index for Black males was 36 years behind white people. So we've been in a crisis, and the illuminated light, the harsh light that COVID-19 is shining upon these disparities was things that we documented 10 years ago. People knew of it. And just like 15 years ago with Hurricane Katrina, when we have a disaster, disparities are exacerbated. They're shown in a very acute light, and we must keep this light on these disparities, but more importantly, we must come together to put things in place to force the stakeholders to make systemic change such that when the next disaster comes down from the sky, from the environment, or from wherever it may come, that our people, once again, will not be at the end of the brunt of that force.
Thank you so much, Dr. Mackey, for setting the context so well for us. Dr. Bryant, when you hear all of these things and in your daily work, what does all of what we see happening have to do with this notion of dehumanization?
Thank you, Brother Jetson. So dehumanization is this persistent invalidation of the humanity of Black people, and this persistent invalidation of their right to basic human rights and basic humanity. And it's rooted in this negative narrative around who Black people are. And so this horrible narrative around our young people being lazy or dangerous, our men being criminals, our women being bad mothers, our men being bad fathers, us being not providers. This whole notion of creating a false and negative narrative is what legitimizes dangerous policy decisions that are then put forth and create vulnerable situations for our people. So when we have policy decisions that limit medical treatment or deny access to safety net programs or limit access to job training or over-criminalize and incarcerate our people, we have to understand that all of it is rooted in this narrative that says that we are unworthy, and that narrative makes it all right for these policy decisions to take place. So, like Dr. Mackey said, we find all of these disparities exacerbated now during this period of COVID-19 because all of these policy decisions have put us in this place where African Americans are overrepresented in our low-wage essential worker population that doesn't have adequate access to protection while they have to do their jobs. At the same time, we're also overrepresented in the population that's unemployed because they can't work during this crisis. More often than not, African Americans are living in crowded housing conditions that makes it easier for the virus to spread and easier for them to be exposed. And we're also dealing with the issues of the over-incarceration, because now as the virus is spreading into our prison system, we know that African Americans and African American males in particular are the ones that are overrepresented in that prison population. So this history of over and over and over again, creating policies that put our people in a vulnerable position now creates this explosion of us being more vulnerable to the virus and being more vulnerable both to sickness and to death. And it's all a result of this historical telling of a dehumanizing narrative that African Americans are less worthy of, they're less worthy of protection, less worthy of health, and less worthy of opportunities to thrive.
Dr. Bryant, thank you so much. Donnie Rose, I had on a brown t-shirt a couple of days ago that had the words on it, "Change the narrative." And I got that shirt from you. And so as you live through this each day, and as you hear the role that narrative has played in all of this, what do you think?
Unmute yourself, Donnie.
All right. Can you hear me?
Yes.
Right. So I kind of want to just reiterate some of the things that Dr. Bryant was mentioning before I kind of lead into your question. So right before I got on the call, I was doing some writing for the North Star, who I've been working with for the last couple of months, which is the online publication ran by the activist Shaun King. And I was particularly writing about economic disparity during this time of COVID-19. And what I was writing about even more specifically was a history of a compromised workforce. And so I just want to quickly run some numbers and then I'll cycle back to what you were saying. So Black workers, according to the US Bureau of Labor Statistics, are 37.7 to 26.9% more likely to be essential employees than white workers. 50% of Black workers are more likely to work in the healthcare and social assistance industry. 40% are more likely to work in hospitals compared with white workers. In New York City, more than 40% of the city's transit workers are Black people. And then something else that kind of struck me as well is that in the midst of all of this, Black workers have seen a considerable decrease in jobs or reduction in hours. So compared to their white counterparts, 45% to 31%, we have seen Black workers either lose their job or endure a reduction in hours, right? And so when we talk about this idea of changing the narrative, for me, what that really looks like is being able to articulate what that narrative is. And so before we get into this conversation of, Black folks, either being quote unquote lazy or quote unquote aloof or, apathetic, we have to address the fact that right now, when you're talking about essential frontline workers, people who are putting their bodies and their livelihoods on the line, you're talking primarily about Black people, right? So that dispels the myth of laziness right offhand. When you're talking about this idea of who is out here, who does not have the luxury to be at home working a telework job, who is out here really like risking life and limb in the interest of their families and in the interest of being able to provide. So that dispels, the mythology of this idea of laziness. I think that, when you talk about this idea of Black folks as, either being, self-contained or selfish, we have to dispel those myths as well. Like when you look at, I watch, my wife and I watch Good Morning America quite often. And one of the main critiques that I have, and I actually tweeted this to them not that long ago, I'm like, man, every time I turn on here, I'm seeing mostly, you know, white families or white celebrities who are being highlighted during this time. You're not talking about the things that, you know, people in the Black community are doing on behalf of not only ourselves, but on behalf of others who are enduring this particular time of pandemic. And so when you're talking about changing the narrative, you're also talking about what does it mean to have people say things about your culture that are inherently not true. You know what I mean? So you cannot say that we're lazy. You cannot say that we are selfish. You cannot say that we are, you know, not not involved in the conversation of how to combat and how to, you know, flatten this curve. I mean, hell, the Surgeon General of the United States is a Black man that people that he's trying to like relay information to people on a regular basis, and has now been essentially kind of frozen out by the administration. And so, you know, like when you talk about again this idea of switching narrative, you talk about this idea of being able to allow Black narrative to be pushed to the forefront. And pushing that to the forefront is not necessarily prioritizing Blackness over anything else. What it is equalizing. Because for a long time, our narratives have been suppressed. And in a moment like this, where you're talking about 70% disparities in cities around the country of Black death due to COVID-19 versus, you know, other ethnicities, like you have to be able to foreground and prioritize that narrative now. And if you don't, then don't be around here talking about you're the land of equality or you're the land of the free or you're the land of, you know, liberation, because you know, in essence are telling the untruth.
Pastor Jetson, if I could just comment real briefly on what Donnie said, and love my brother Donnie to death, but one thing I will disagree with him on, I'm not too excited about our Surgeon General. For him to be referring to Blacks as Big Mama and some of the comments that he made, the stereotypical comments, I have many African Americans that are dying or have died from COVID-19, and my personal patients, some are personal friends of mine, that that had great incomes and worked great jobs, but they did have these underlying health conditions that weren't being addressed. And so if you look, and you guys all, if you guys have been watching the news lately, Dr. Phil, Dr. Oz, a gentleman named Dr. Jim McCullough, what's the other cat? Dr. Drew, have all been reprimanded or tapped on the wrist for giving misinformation. With COVID-19 came a lot of misinformation and myths that need to be dispelled. And so a lot of our African-American people are getting information from these TV doctors who aren't giving them the truth and giving them real information. And so not so excited about our Surgeon General, but I do think we need more Black doctors and more people that look like us giving this information, reliable information to our young people. And I digress, but I just had to make that point, Don.
No, that's real. I think that probably what I was getting at, because I've also seen and heard a lot of the critique, is that, you know, dude, with flaws and errors and even saying things incorrectly, he absolutely has a higher bar to clear, you know what I mean, than a lot of his medical counterparts. Because the people that you just named who are nowhere in that position whatsoever have been, you know, tapped on the shoulder by the president himself, you know what I mean? So it just kind of goes back to this idea, this ideology of having to be 3 times as good, you know, to be accepted as, but you're absolutely right. He definitely needs to be more cognizant of the information and of just what he's presenting.
So thank you. Dr. Whitfield, you touched on something that I'd like for you to share just a few more words on. You talked about the importance of doctors and healthcare professionals who look like the community that's being impacted. Right. How do we lift up those voices?
Well, and before we jump there, I'll just say we're not that far from Tuskegee experiments that were done on Black men. We're not that far from stealing cancer cells from Henrietta Lacks to help other patients and not giving credit to Black folks for doing that. We are not that far from Jim Crow and the separate but unequal treatment of Black folks medically during the Jim Crow eras. And so it's really hard to encourage young Black folks to want to be doctors when they don't see doctors. They say if you want to be something, you need to see it. And so, you know, Pastor Justin, and you and I, oh man, that's more money I owe you. I got a credit card.
Okay.
But People laughed at the hip hop doc. A 51-year-old man, when I started this, I was 39, laughed at me for wanting to rap and go into communities to target a small population of young people. And that small population has been thousands, but I've been following Dr. Mackey's movement as well. And all I wanted to do was change the narrative, as because I have that shirt that you bought from Donnie as well, but as the hip hop doc, to reach a certain set of people, not people that hate rap, not people that hate gospel, not people that hate rock and roll, but a certain set of people that targeted hip hop. And that was the passion that I had for music. And so that's why I went in that direction. Attended Meharry Medical College, a black school that taught us bedside manner, and that not just knowing what your HDL and cholesterol numbers meant, but knowing that you have to be able to relate to these patients. So getting outside of the box, going into the communities, and we have to do whatever is necessary and possible to reach our people. We need a robust campaign of getting outside the house. I know it's hard because of social distancing, but if I had the resources to get in the truck and drive through South Baton Rouge and say, go get tested on a microphone or go get yourself checked, that's the kind of things that you have to do. Our culture is different, and so you have to approach them differently. And so it's been truly a blessing to be the hip hop doctor, be able to go into rooms. I had a white physician call me last week, said, Dr. Whitfield, how can I help you? Because I can't walk in the same rooms that you can walk in, but you can come in my doors. And so those are the things we need to do. We need to encourage and make sure there are incentives for young black men and women to go to medical school and come back to the communities where they live to help, and particularly the lower income communities. And that's been my goal. I know some of you guys probably think this guy is crazy, silly out here rapping at 51, but I promise you there's a method behind the madness, and it's just to make a difference, to truly change the narrative and reach the young people.
Thank you. I appreciate that so much. And I want to get a round robin going here. But Judge Grover, I do want to ask you, Dr. Bryant made comments about mass incarceration and its impact. Brother Donnie raised the issue also. Being in the juvenile justice system, what do you think about what it is you've seen?
Well, I think COVID-19 again shows us what we have articulated tonight and have known is that people of color are overrepresented in areas that are to our detriment in resisting the virus, and we are underrepresented in areas that would be a benefit in our resisting of the virus, meaning that whether it's employment or education, that not being in those industries where you can work from home. You know, they've been talking about working from home, and when you think about that, and you think about people of color having that ability without giving a second thought of what that looks like, or from education, having education from home, and then thinking about many of our families of color who may not have access so easily to continue that. And then whether we are overrepresented, as Doc was talking about, as far as healthcare and having those underlining conditions that make people of color more vulnerable, as the numbers are showing. What I also wanted to comment on is that the narrative that everyone was talking about is so true, but when we couple the narrative of our communities, of our nation, with the dynamics of structural racialization on how systems interact with each other in order to perpetuate the disparity that we see, that is surfaced as well. That is very relevant, and COVID-19 has exposed that. As I looked in the detention facility with our youth here locally, we have 100% African American that is detained here locally. We've done a lot of work in juvenile justice to bring down our numbers, and as of today, we have 29 youth that are in our detention facility here locally. And as I stated, 100% are African American, and all but one are males. And so as we take a snapshot of today, the question was, what was the snapshot of yesterday and day before yesterday? What will be the snapshot tomorrow? and how are our systems interacting together in order to interrupt that? One of my biggest concerns as I saw us go to work at home is how to reduce the impact of the interruption of due process to those individuals who are sitting in our detention facility. How do we protect them as they sit in these facilities? And so I think COVID-19 has revealed what we know, but the question becomes, and I think you stated well, what do we do about that? Where do we go from here about resolving these issues, taking it a step further?
Thank you. Panelists, just comments on things that you've heard.
This is Calvin Mackey. I wanted to add, sometimes A, B, when you take these standardized tests, how kids get all confused because they have A, B, C, and D. A lot of time I tell my son, when you're confused, press D. And D is all of the above. Sometimes you want to take these things and separate them and make them individual objects when they're so interconnected and complex that is often difficult to untangle them. So in my Forbes article, Brother Jetson, I wrote about STEM and a coronavirus because I said this is a public health catastrophe, but a STEM disaster. And when you look at it from a science, technology, engineering, mathematics perspective, one thing Dr. Whitfield was talking about is that it has been proven. Research shows that if someone is being taken care of by a Black doctor or a Black healthcare professional, they receive better health if they're Black. But we know that the number of Black males that's going into med school is less than the number that entered in 1972, 2 years ago. So the issue in our community of exposure and engagement and meeting our kids where they are when they're very young to show them and give them the possibilities such that they don't end up as one of those 29 out of 100, however many locked up. We have to address the systemic issues from a policy standpoint, but there are things that we must do on the ground that we must be committed to go into the community and make sure that we stymie some of the trends that we see with our children and family and communities.
Thank you.
Dr. Mackey, when you think about that, again, it takes me back to systems, how our justice system interacts with our education system and interacts with our healthcare system as we still deal with transportation. I mean, at what point will we stop having transportation drive how our community receives services? But all of those things overlapping and interacting, and institutions not using a lens that will interrupt that systemic racism or the way that our systems perpetuate disparities.
And I think we have to be focused on what are the systems change and reform solutions that we need to be advancing during this time. And many of them are things that we have long been advocating for and haven't been able to get past. Mm-hmm. And so I'm hoping that during this pandemic, we are able to resurface some of those policy pushes and search for some opportunities to create change. So for example, I think about the fact that, you raised the numbers of young people that are in juvenile incarceration. Had we been more proactive in all of our communities around ensuring that African-American young people had greater access to community interventions instead of always being incarcerated, that is something we've been pushing for a very, very long time. When we think about the way that our education system functions and how we don't have the dollars in place to really take our schools into the 21st century and make sure that they have access to all of the technology, mm-hmm. What are the opportunities now? Folk are scrambling to say, let's buy laptops, let's get hotspots, et cetera. What if we had that infrastructure built into our schools that served our kids prior to now? Mm-hmm. So what are the asks that we should be putting forward to make sure that after this is all over, we have actually impacted the systems in a meaningful way?
Pastor Jensen, there was a study that came out recently from the Pew Institute, and it talked about, and I'm piggybacking off what Donnie said earlier about us being lazy and not concerned. and it ranked by race who was more worried about this virus, and it was African American folks. And I see that in my practice. My Black patients are asking about masks. My Black patients are asking about hydroxychloroquine. Is it legit? Will it work? And so it's very dismissive and insulting for individuals to imply that we're lazy and not concerned about this virus. But when you lack the resources, when you have to go to work, when you're living paycheck to paycheck, you don't have paid time off, you don't have sick leave, when you're more or less likely to have the ability to work from home and do telehealth or telemedicine, as I've been doing in my office, been blessed to be in my office, then you have to go to work. And what do? You go to work, you're probably not provided PPE, protective equipment. So you're around a bunch of men, you get infected, and you go home to a 800 square foot apartment, and you're spreading that virus to your family, and they're taking it out because they're also essential employees that are working. And so this is what people aren't really looking at. You know, it's the real data. And I see this in my office every day. Doc, I got to go to work. I went to work sick. I had a sore throat, which is potentially one of the symptoms. We listen, guys, the only thing we know about this virus right now is that it's spreading like wildfire. There were 10,000 deaths on April 10th. There are almost 50,000 people in the United States that have died from this virus. And for people to say the flu in its season from September, October to April, March, had killed about 55, 60,000. We've already lost close to 50,000 people in a little less than 2 months. If you guys don't think this virus is serious, that Black folks, because we got melanin, we can't get it, you better think again, because the people that I'm seeing that are dying from it look majority like me.
I want to comment real quick because education was brought up a while back. And for me, when I think about, as the saying goes, you know, America gets the cold, Black folks get the flu. I think about just how already inequitable situations are greatly exacerbated in these times. And I'll give you a very tangible example. As a teaching artist, I was working in about 4 different schools in EBR Parish. The one school that I've been teaching in that's not a part of the public school system is U High. Guess what school is the only school that's still receiving workshops from me? University High. Every Friday, I'm logging on to work with young people in the U High classroom, and I love those kids. I love their teacher. You know, they're great kids. She's a great person. But the fact that those young people have access to adequate laptops, have access to, you know, good Wi-Fi, have access to stable or quality homes. Some of them, you know, come from 6-figure or even millionaire, you know, backgrounds. Where on the other hand, there are young people who I was working with through EBR where we're scrambling trying to find them right now, trying to offer them programming, trying to offer them resources via Humanities AMP. It's a struggle to find them. But I can log on every Friday and find that primarily white student population at U High and teach them. And so they are receiving arts and culture on a regular basis, in addition to whatever, you know, just protection from virus that they're receiving or whatever the spoils of affluence affords them. And so, you know, when we're talking about what does it mean to exacerbate an already inequitable place, like Baton Rouge is like ground zero for what it means to have a large gap between resources. And, you know, we consistently have this conversation that kind of pivots between personal accountability and systemic accountability. I'm about both. I'm about us trying to figure out how can we assist and help our own, but I'm also about like, how do we call the people who are in charge to task and say, look, this is an inequitable situation. We got children out here that are being deprived of education because they don't have basic resources. Whereas on the other hand, there are kids on the other side of town that may have access that are being able to continually be educated throughout this whole process.
So Donnie, I want to put a pause there. I want to say to you, Judge Grover, Dr. Bryant, Dr. Whitfield, Dr. Mackey, thank you for the wisdom that you have shared with the folks who are in this. Thank you for your time. Thank you for what you do for our community. I am in your debt. To those participants who are sharing with us, you are going to be now randomly assigned to a breakout conversation. please click to go into your breakout group. There's a facilitator who will meet you in that group, and they have a couple of really interesting questions to ask you. And we'll do that for about 20 minutes, and we'll come back and we'll say thank you for your time. And I hope that you will show your appreciation and say thank you in your own way to these wonderful panelists. Thank you guys so much for your contribution to this conversation. It's time for the breakout room.
I have to get ready for another
Yes.
dialogue. Thank
Yes.
y'all.
Thank you, Donnie.
All right.
Thank you, Brother Jetson.
So I didn't get the opportunity to take the survey. Is any way I can take it right now? We was in a room, but we didn't get an opportunity to take the survey.
Yes, 1 minute.
All right, thank you.
Yes, Eugene, we're going to relaunch the survey for you guys.
Thank you. And this one of those pretty amazing, by the way.
Eugene Bentley, this is Rhoda Mitchell. It is so good to see you, brother. It is
Brother Mitchell, how you doing?
You looking good too, baby.
Thank you.
God bless you, man.
God bless you also.
And so I want to take this opportunity. There is the poll. We'd certainly invite you guys to take it. And if you would submit that, we'd appreciate it greatly. I want to thank you guys. I can only hope that your small groups were as rich as the one I had the privilege of sharing in. I hope that you guys found the panel conversation engaging and thought-provoking. We so much appreciate your time. On behalf again of the Metromorphosis team, the delegates to the Urban Congress on African American Males, and the panel, I am thankful for your contribution, for your participation. What happens next is we're going to collect the information from all of the breakout groups. We're going to bring that together and we will be issuing a report to you in true Metromorphosis fashion. You will have a report from us in 2 weeks. And so in not more than 2 weeks from today, you will be receiving a report from us on this conversation, which is part 3 of our focus around dehumanization. And so thank you so very much for your time. Thanks to the Metromorphosis team for making this happen. Have a great evening and God bless each of you. Thank you for your time.